welcome to the meet and greet with folks for LGBT resources on campus. My name is Loretta Rowley. I am a student success advocate at the University of Utah, and I just want to let our campus partners go ahead and introduce themselves. Shelby, if you want to go.
Go first, sure. Hi all, my name is Shelby Hearn. I use they and she pronouns interchangeably. I'm the coordinator of education and outreach in the LGBT Resource Center at the university. I'll pass it off to Ariel.
Thanks, Shelby. My name is Ariel. I use she, her pronouns, and I am the program coordinator for the Transgender Health Program. And I'll pass it over to Claire, who's also on my team.
Hi, I'm Claire. I'm the patient coordinator for the Transgender Health Program, and I also use she, her pronouns. I will pass it over to Jack.
Hi there, my name's Jack. My pronouns are he or they interchangeably, and I am an LCSW at the University Counseling Center, so I provide individual and group counseling as well as crisis counseling for students on campus.
And my name is Tim Davis. I use he, him, his pronouns. I'm the Associate Director for Residential Education. Excited to join you all today and see a few new and familiar faces.
I'm going to tag Jessica there real quick just so she has a chance to.
Thank you. Sorry, Jessica.
No, you're good. Hey everyone, I'm Jessica Hernandez. I use she, her pronouns, and I'm the grad assistant in the LGBT Resource Center. Hello. Is there anyone else left?
Cool. I think we got everyone. So just to preview a little bit of what we'll be going over today. So we are going to be recording the first part, introductions to each of the offices and resources. And then we'll go ahead and turn off the recording and then open it up to question and answer. If you do have a question and want to go ahead and throw it in the chat as we're having the introductions to each office, feel free to do so, and then we'll make sure to get to those questions when we get to the question and answer portion. So I'll just give you a tiny plug real quick for student success advocates at the U. There are 11 of us, I believe, and we essentially are kind of like advisor, mentor combos in all things campus and navigating resources that can be helping you find research, helping you connect to certain offices, answering questions. It's kind of everything and anything under the sun that helps assist you in being successful at the U, however you define that. So if you're interested, go to our website. It's ssa.utah.edu, and you can read up bios on each of the student success advocates. We have cell phones that you can call or text, and numbers and emails are listed on there. So without further ado, I did want to go ahead and pass it off to Shelby and Jessica to go ahead and introduce us a little bit to the LGBT Resource Center.
Thank you, Loretta. All right, I'm going to pull up, I'm just going to share my screen real quick here for some slides, just because I find that's easiest to follow along with me and the large amount of information I'm about to try to pack into a couple of minutes. So here you have, like I said, I work for the LGBT Resource Center here at the university. I'm going to give y'all just like a brief summary, talk a little bit about who our staff is so you know who's who working with us, and then I'll go into more detail about the different services that we provide. So the LGBT Resource Center, as an overview, we provide support, leadership development, advocacy, community building for LGBTQIA students, as well as educational workshops and opportunities to celebrate LGBTQIA identities for the entire campus. So that's us in the briefest of nutshells. We are really, really privileged to have 3 full-time staff members at the Resource Center. So that's myself in the coordinator position. Our director's name is Dr. Claire Lemke, who's the she, her pronouns, and our executive secretary who keeps all of us up and running is Bree Peacock, also using she, her pronouns. And then we have, at the moment, 2 student staff members. So it's Moani Tuitpo, who's a student staff member, uses they, them pronouns. They're an undergraduate staff. And then Jessica, who you've met here in the Zoom call, is our graduate assistant using she and her pronouns. You'll see them usually when it comes to some of the community building events that we put on that I'll talk about. They're primary facilitators and faces during those programs. So our office, the way we talk about our work is through this kind of idea of 5 pillars of work: advocacy, student support, education, leadership development, and community building. So I'll start with student support, as that tends to be our most robust of work that we do, as far as like what we directly do one-on-one typically with students, how we offer support. So myself and Claire hold one-on-one support meetings with students. If you have a question, if you are in need of resources on campus, but you're not really sure where to turn or feel hesitant about a place and whether or not it feels safe for you to go to, you can always come chat with us first and we can do a warm handoff. Or we can just kind of talk through anything that might be on your mind, strategies for coming out process, anything like that. Claire and I are really happy to have those conversations with students. Right now, we're primarily operating virtually, so you can email us for an appointment and we'll chat like this over Zoom. Or you can come to our drop-in hours, which is through the ConnectSed platform, which if you've used it yet, maybe to talk to an SSA or to an advisor. Our drop-in hours right now are on Tuesdays from 5 to 7 p.m., Wednesdays and Thursdays from 11 to 1 p.m. When our center is open, it's open from 8 to 5, and in it we've got a computer lab with free printing and typically have coffee and tea and snacks available, as well as a library of a lot of books and magazines. And we recently have started a local, like, University of Utah zine collection. We have our Queer Peers anonymous messaging service that you can access through our website. So if you're feeling a little too unsure about directly emailing me or Claire or coming into our drop-in hours, you can use the anonymous messaging service, and that doesn't connect you to a UID or to an email, and you can kind of chat with us through that. And then if you're feeling more comfy later, we can continue our conversations more in person. We have emergency funding and scholarships. Those are our 2 financial resources we offer. Scholarships, those are available to undergrad and grad students, as well as to undocumented and documented students from Utah high schools. So long as you have a 2.5 GPA or higher, we tend to award those in the spring. Amounts kind of vary throughout the year to year, because they're based purely on donations. And then we have our emergency funding, and that's for non-tuition related costs. If your car gets impounded, if you suddenly lose your job and you're not sure how you're going to make rent this month, you can apply for emergency funding through our office, and we can help you pay those expenses to make sure that you're able to focus on school and stay enrolled throughout the semester. And then we offer an admissions appeal sponsorship. If a student is admitted to the university on appeal, we can sponsor them when we provide academic mentorship through that process. Our leadership development pillar, we have a leadership program called right now the Emerging Student Leadership Program. Applications and interviews are in the fall semester, and then all through spring, a cohort of about 10 students meet every single week, and we really kind of spend time troubling the typical ideas of leadership that can be really male-centric, white, and hetero and cis. And so we're spending time queering the idea of leadership and working on students' leadership identities. It involves going to a conference. This year it'll be virtual, and working on a few capstone projects towards the end of the spring. We also have student employment, internships, and practicums. In fact, we're hiring right now for a 3rd student staff member. So if you're interested and happen to be a federal work study eligible, please contact me and you can apply. We have volunteer opportunities with our office, and then for some of our bigger events, we tend to put together some committees, and if you're interested in taking part in event planning, you can be on some of our event committees as well. Our community building and celebration comes about in a lot of different ways. So this coming year, we're gonna have a virtual lounge officially going to be available on Discord. We'll have that set up by the beginning of the fall semester, where students will be able to interact with other students at that lounge at any time, as well as with our office. In a more casual setting, there's no time limit or anything like that. You can just kind of come and chat. We're going to continue to have our Fabulous Fridays. Those are weekly from 3 to 5. They'll happen over Zoom. Typically, they're pretty loose in structure with games. In the past, we've had things like Wii tournaments or Queer Jeopardy. this coming fall semester, we're going to have a murder mystery Fab Friday, I believe, and we're also going to be doing a queer media series through our Fab Fridays, watching a lot of movies and television shows and having some good discussion about those. Our big QT welcome is our annual welcome event in the fall for new and returning students, a really great way to connect with us at the very beginning of the year. We'll be having that this year on August 26th. We're in the planning stages of some queer and trans people of color community building. There was previously a queer and trans students of color student organization that after some students graduated has gone on hiatus. We still have funds for that group. If you're interested in being a part of something like that, we can work with you to build that back up into a active organization. We're also in the planning stages of doing some regular programming for affinity spaces for QT-POC. We have our Pride Week. It's officially in spring 2021. It's a week of the whole university coming together to celebrate LGBTQIA identities. There's drag shows, there's really cool lectures. It's a really exciting opportunity, and that's one of those events that if you want to be a part of planning it, there's an event committee associated with it. And there's our Lavender graduation at the end of the year. Gets to celebrate all of our fantastic graduating students. I hope to see you in a few years at one of our Lavender graduation celebrations. Our educational arm of things involves our workshops program. I facilitate trainings and workshops all over campus, both for campus departments and student groups, on all sorts of topics from pronouns to inclusive classroom practices to what inclusive restroom signage should look like. I facilitate a whole lot of dialogues like that. We have our Queer Conversations series. Those are twice a semester and involve topics in the past have ranged from why it can be hard to go home during breaks. We actually did that conversation in partnership with the Counseling Center and the Black Cultural Center. We've talked about queer representation in the media, and our most recent one was about zines and their impact on queer communities historically. And then we have our Inquiring Minds podcast, which because we're going virtual this year, we'll really see kind of, I think, an uptick in how many podcasts we put out to really supplement some of our programs and our educational pieces. And I do consultations and collaborations across campus on creating a more inclusive and equitable campus. And finally, we have our advocacy piece. That tends to be the most behind the scenes work, stuff that students don't necessarily engage with directly, but I do like to talk about it a little bit just so y'all know what it is that our office is up to make sure that the entire campus is serving you. So like here is just a very, very small fraction of the different rooms that Claire and I and Bree and even our students are in and have it in the conversations that we're having. So I'm a Deputy Title IX coordinator. We have an inclusive restroom task force. There's a basic needs center collective and an IPV prevention and education collective, just to name a couple of the advocacy groups that we're a part of. So that is us in the quickest nutshell that I could possibly do. Up here, just really quick, is the best ways to contact me and just our center. And you can find here also our social media, which is the, especially right now, ideal way to be engaging with our office and the different educational and social pieces that we're putting together for the next year. Did it.
Awesome. Thank you, Shelby. Up next, we'll go ahead and hear from Ariel with the Transgender Health Program.
Hey, awesome. So I will also bring a PowerPoint up if I can get that figured out. Okay, hopefully everybody can see my screen okay. So we are the Transgender Health Program. Our administrative offices are located up at the hospital, but we're spread across the entire university throughout the clinics. So you have met myself and Claire. So my role Predominantly, you might see me at our patient education seminars. I do a lot of community outreach, and the rest of the stuff I do is usually system-wide education throughout the hospitals and clinics on LGBT, but specifically trans health topics and best practices. And then Claire is our patient navigator. She will work directly with you if you are someone that would be seeking healthcare services from us. She will navigate you through our program. We have several services that she'll speak to. She also sets up appointments, facilitates communication between providers and yourself or your family members. Yeah. So our website, I'll give you the link at the end. Our website has a bunch of information on it. It's a great place to start if you're looking for transgender healthcare at the U. We have over 40 providers in our program across 8 different specialties, and all have been through comprehensive LGBT trans-specific healthcare competency trainings. And so you can easily go to our website and click in by location or by specialty and find providers that way, or you can always email Claire and she can help you find a provider that you're looking for. I like to go over our mission statement just to express to patients what our priorities are and how we're committed to their care. So our program is committed to providing comprehensive, compassionate, evidence-based care for gender diverse individuals in a supportive, affirming environment. And our objectives and values include intersectionality, coordinated care, research, and education. And that looks like a lot of things across the campus that we work on. But just communicating that up front to let people know that those are kind of the values and the things that we prioritize when we talk about our program. So I'm going to turn the time over to Claire to kind of talk about our services and how you can access us.
Hello. Yeah, so we are a multidisciplinary coordinated care program. So obviously, we offer a bunch of different services. So primary care, hormone therapy, HIV PrEP, contraception, fertility, and then over to the surgical side of things. So our team is all connected, which is really great. So we can all communicate with one another. And if you see your primary care provider, they can send a referral for you to see one of the surgeons if that's something you're interested in. So it's really easy for us to kind of communicate and make sure that you are getting all the resources that you need.
Sorry, it's being a little slow on my end.
No worries, good.
Oh, too far. There we go.
Yeah, so, and then other services that we do offer as well are, we do monthly patient education seminars. They have different topics, as you can kind of see our schedule on this little flyer. And you can register for those on our website. They typically involve a provider kind of going through a presentation explaining the topic, and then there's usually a Q&A with the providers as well as a Q&A with patient panelists as well. So we've got several patients who have gone through the services themselves that you can ask questions to. And then the other service that we offer as well is a peer support service. So you can connect with a fellow patient who has had the services done, and they volunteer to be a peer, and you guys can kind of communicate and you can have direct contact to answer your questions. So patient journeys, obviously everyone is in a different part of their life, dealing with different stressors or different areas of care that they're looking for, whether it's primary care or surgery. Just depends on what stage you're at, but we are able to help you any step of your journey, and we're more than happy to help. So just reach out. So you don't need a referral. That is a question that we get pretty often, is referrals. you don't need one from a provider or anything like that. You can just self-refer. So you're more than welcome to either give us a phone call, or you can email me directly, or email our Transgender Health Program email. And we will answer any questions you have and see if we can get you to the resources that you need. Another thing just kind of to go over is WPATH. So the WPATH guidelines are the guidelines that are kind of put together by a bunch of different healthcare professionals. So there's just guidelines pretty much that state what criteria you have to meet in order to have certain care. And they are guidelines that our program follows, and most insurance companies are also in line with the WPATH guidelines. So it's something just to be like thinking about and kind of taking a look at, and it also takes into account the aspect of mental health care as well.
So this is just generally where you can reach us. You can email us directly, call us, or visit our website. And we're happy to answer any questions that you might have.
Awesome, thank you. Up next, we're going to hear from Tim with the Housing and Residential Education.
Thank you. Awesome presentation so far, y'all. So thank you. I want to continue with us talking about housing and residential education. I have pulled up our website so you can learn a little bit more about some of the specific resources that we provide for LGBT students. So here we are at housing.utah.edu. We have a specific living and learning themed community called our Alliance House. So if I went to our housing homepage, clicked on menu, housing options, there's living and learning and theme communities. That brings me to this homepage, Alliance House. So Alliance House is the community that I act as an advisor for. This community is specifically created for LGBTQIA students looking for a safe space in housing with other members of the community. So this is a unique space on campus. It's a house. There's 13 residents, and resident advisors specifically trained to support LGBTQIA students. So this house, and then I act as an advisor with it, so checking in with students on a regular basis. And it is our space, a space on campus where we do not assign genders to our spaces, our rooms, that folks can live with anybody else in the spaces. There are single and double rooms in this house. There's specific programming and events that we connect with for residents of the community. So definitely something to look into. One of the things I do share with folks who are looking at housing opportunities, if they're considering the Alliance House, it is visibly queer. So there are elements where it would denote that someone may be a member or at least an ally to the LGBT community. So if they're looking for that safe space of connecting with other queer students living on campus, that this house does have that element. Conversely, many of our LGBTQIA students will choose to live in gender inclusive housing. So back on that navigational pane on the housing website, there is gender inclusive housing. So we have, one of the things we take special care to do every year is to reserve housing in all of our different residential community styles, specifically for gender inclusive housing. So that way that folks can have a space that's comfortable to them, also meets like their additional needs, right? Like we are many multiplicity of complex identities, experiences. So our gender inclusive housing processes allows you to reserve a space on campus, potentially also choose specific roommates regardless of gender identity or non-conforming identity to also be your roommates. So this process walks through what you do with that and gets you in contact with a specific housing professional who will help coordinate that. That also includes usually a touch point with me where then we'll talk through like, hey, is Alliance House that specific community you're looking for, or would it be another place on campus? So there's additional guidance there for the for LGBTQIA students. Definitely would be happy to work with any individuals specifically. And if you haven't gotten housing already for this year, reach out to me and we can talk privately in the chat or via email and figure out something for you for this fall if you're still looking. So thanks, y'all. Happy to chat more in the question and answer afterward.
Awesome. Thanks, Tim. And up next, we will hear from Jack with the Counseling Center.
Excellent. First of all, before I go in, I want to apologize for the lighting. My lighting decided to not work, so I'm typically not this melancholy in appearance. Nevertheless, I am going to attempt to share my screen here to get you looking at our counseling services page. Hold on just a sec. All right. So at the Counseling Center, we provide a lot of different services, but what drives most of ours is our mission statement that we're going to provide care to any and all individuals who come. And we have a very overt mission statement that says that we are not going to turn anybody away based on their background, their gender identity, anything like that. So something to keep in mind is that all of our staff, and we're currently in the process of hiring new staff, but we have about 20 permanent clinical staff members, as well as psychology interns, social work interns, counseling, psychology interns, all sorts, who provide counseling, and we are all members of the LGBT Affirmative Therapists Guild. So we all go through training in providing the most competent and up-to-date care for folks who identify as LGBTQIA. Part of what we do is, let's see if there we go. With our services, we provide all sorts of things. We provide individual counseling. So that would mean meeting with a counselor for anywhere between 1 to 12 sessions per calendar year. We do offer short-term counseling, but we find that most of our students that come in generally use about 5 to 6 based on their needs, but we don't turn anybody away based on what their needs are. But individual counseling, group counseling, we have a host of different groups, and this also includes support groups. I currently am facilitating a group specifically for trans and gender nonconforming individuals called Beyond Binaries. We've been meeting since spring semester, and we're currently meeting over Zoom, and we're all meeting over Zoom for all of our services currently. But our group counseling is a great option to develop community, to develop different skills, and also find nourishing relationships, which can be so necessary to work on when we're coming into school, when we're coming into issues regarding interactions with other people, and with the coming out process as well as other LGBT issues. We offer couples counseling. We offer this for any and all relationships. So queer counseling is a big part of our work with that. We also offer psychiatric medication services. We're currently, I know our 2 APRNs, psychiatric nurse practitioners, are looking into how we can facilitate getting linked to providing HRT. That's currently not offered, but we do have great referrals, the Trans Health Program being one of them. Our Mindfulness Center is a center where we provide a host of different workshops and educational opportunities, as well as a 4-week series called Feel Better Now, which is aimed at developing coping strategies to manage stress, anxiety, and depression. So while not LGBT specific, it does offer some great skills on how to manage things that come up while on campus. So something to keep in mind for that. Our other service that I help provide is our crisis services. And when you think of crisis, you think, at least typically, people being at risk of hurting themselves or hurting others, but we also tailor our crisis services to address issues of assault, as well as microaggressions, which can frequently come up unfortunately, for folks of marginalized identities. So if a student is experiencing microaggressions based on their gender identity, sexual orientation, we have crisis services available Monday through Friday, 8 to 5. So you can call in and speak with a counselor and process what's coming up for you, find some better resources to help keep you feeling safe, and maybe get you linked with some ongoing services if that's what's needed. One thing that we do offer as well is outreach and training. So we do outreach presentations for any and all agencies or campus partners based on a lot of different things, but we have been lucky and fortunate enough to collaborate with the LGBT Resource Center on some different LGBT focused conversations on finding support for issues that face students who identify as such on campus, helping link students to resources that are needed both on campus, on off campus. So that's something that we really pride ourselves on educating not only students on the resources, but staff and faculty as well. We offer a lot of resources that come across for self-help. So some of that might include those coping strategies that I mentioned that we offer through our mindfulness center, but we also look at what's going to be helpful for students of all sorts. Something that I've often referred our students to is the Safe UT app. It's not necessarily a self-help app, but it is linked to the Uni crisis line where you can get some immediate support when and if you're not able to come to the counseling center. And as I said, diversity is a big part of our mission statement. So we try to tailor our services to meet the needs of students of all kinds, including LGBT students. Part of our diversity efforts are developing the skills to support students in all manners of ways. And that includes being able to provide letters of support for those who might be seeking medical transition of some sort. Typically, we do ask that students need to be engaged in counseling either with us or with other community providers to provide that kind of care. But we recognize that this is a necessary step in a lot of people's journeys when it comes to expressing their true selves. So that is something that we can offer. And I realize that I'm kind of rambling at this point, so I'm gonna put that on hold there, but just want to put it out there that if people are interested in getting in touch with the Counseling Center, going to our website at counselingcenter.utah.edu, we'll have a host of different links that you can follow, but also giving us a call to set up an intake to get established with a counselor or get linked with one of our case management services to find somebody in the community. We're always available, and we're currently accepting intakes and likely able to get students in about a week or two for that initial intake.
Great. Thank you, Jack. And thank you to all of the presenters from our offices. I do know that was a whole host of information for you all to take in at once. So we did have a recording. We'll make it available on our SSA events webpage for you to be able to review. I am going to stop recording now so that we can also address some of your questions and more individual information if you like.